Hi there, welcome to our YouTube channel, and in this video we will be learning about health system and reform. Before we start, what do we mean by health system? Health system is any organization, any institution or resources those work individually or in a group or together in collaboration to improve health indicator or health system or health status of a state is known as a health system. It's integrated. So let's start with the definition. What is a health system? As I said, health systems are defined as comprising all the organizations, institutions, and resources that are devoted to producing health action. What do we mean by health actions? Health actions are any effort or any activities any individual or group do to improve health indicators, known as health actions. So, moving to the next slide. What is the role of the state in a health system? Here we are talking about the state. State in the sense country as a whole, state of a country, division of a state, union territory, or you can say as a district. What they do? They do policy analysis or policy making. How they do that? They collect the data at regular intervals from the health system, from their staff, starting bottom to top, and they form a policy or a program which connects one or more projects in it. Then what they do? The state finance that program. Then based on the health facilities, they implement and they own the guidelines to regulate their program or projects. So start with the first. What they do? Policy making. As I said, financing. State finances public health programs and projects, and in some instances they do finance private healthcare services. Those are intended to improve public health status. Third, service provision through government facilities or in collaboration or partnership with the private organizations or NGOs. Finally, they regulate the program based on their guidelines. Moving to the next slide. How health system work in our country in both the scenario, public as well as private, starting from bottom to top, village to metros or centrals. At village level, we have community health volunteers, ASHA IWW. In public health sector and in the private, we have traditional healers. If we go to the village, we have sub-center where we have auxiliary nurse midwife, MPHW, multi-purpose health worker, male and female. Then you go to private, you have traditional healers or RMPs, registered medical practitioners. If you go to a little big village or a block which is having a population of 10,000 to 30,000 based on public health standards, we have a public health center where we do have a medical officer who will be having a MBBS degree, and nowadays we do have Ayush medical officers, whether they are having Ayurvedic or homeopathy degrees. In the private, we have general practitioners, private pharmacies. Now if you move to the towns, we have community health center, and there we have 6 medical officers and we have a pediatrician, a gynecologist based on our Indian public health standards. On the private side, we have general practitioners, small hospitals or clinics. Now we move to district headquarters. We have a district hospital in public sector. In the private, we have hospitals, nursing home, specialist. State headquarters, we have tertiary care, teaching hospital. In the private, we have big hospital, super specialty hospital, or some corporate hospitals. And now if you move to metros, our topmost centrals, we have super specialty hospital, and in private we have corporate hospitals. big corporate hospitals. So this is how the healthcare system works in our country. Moving to the next slide. How a health system thinks, or what is a system thinking? A government system thinking. You can say this is the same process by which a government or a private system think, but here we are talking about government system thinking. So as we have a process level in a computer system, so I put it input, process, output, utilization and outcome. So in input we have human resources, infrastructure in place, procurement, logistic and supply information. We have a leadership and governance. Then if you put all these together, we process, we provide services. Then what we get in output? Services. And services we measure based on their availability, affordability, the quality of services, acceptability of the services, and adequacy of the services based on that local region. Then how we measure services? Based on their utilization. Utilization in the sense of coverage, or what changes we made in the society. For an example, immunization program, or a health service is a health facility is providing immunization services. How much immunization they have covered in that particular area or locality, or what behavioral changes they made if the people are having health seeking behavior. Now come outcome. Outcome, here I have listed the positive ones: improved health, reduced mortality. You can say based on the services, or if there are no services, then you can say health condition or health status deprived, increased mortality, there may be increased morbidity or decreased morbidity. And if we go through the determinants of health other than all these, so we have like economical, social and political effort which affects all cycle or the system thinking. So this is how we work in our country as a public health system. Moving to the next slide. What are the building blocks of public health system, or how our public health system work? Starting from basic, essential and response. To have a public health system, first we should have a workforce. They must be capable and competent enough to provide services. Then we have information and data systems and organizational capacity. If we talk about a PSC, a public health center, then the capacity of that particular PSC, starting from medical officer to the ward boy. Then we have essential capabilities. If they are providing all kind of services, starting from OPD to IPD, what they do: surveillance, laboratory practices, epidemic investigations. Then we have a public health response. Overall, we call this as building blocks of a public health system in our country. Moving to the next slide. What are the domains of health system reform? So here I categorized 4 main domains which I think should be included in any health sector reform. Why we do reform? First, to improve the quality of the services, to improve the response of the services, or to remote services, or to provide services in remote or interior areas in time or affordable. Then to strengthen our governance and management system, or to enhance or increase community participation, because a community participation is a must for every successful program or project in health system or in any system. Or to strengthen our financial management system, how to improve public expenditure on health. As in India, we don't have much of health insurance schemes, so people have to pay from their pocket. So, how do we improve public health expenditure on health? So, this is what I have for today's discussion. Thanks for watching this video. Don't forget to like and subscribe our YouTube channel. Bye bye. See you soon.